This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. You can follow, subscribe, and share on your favorite podcast platform. If you have questions or topic suggestions for Wendy, you can call us at 248-651-5010 or email at hello@nextstepsforseniors.com.
Hello and welcome to Next Steps for Seniors, Conversations on Aging. I'm your host, Wendy Jones, and each and every week, we really do our best to bring information that's pertinent. We all go through life and we all age. Yep, I said it. It happens. Now, some of us age better than others, but our topic today is really advocating for yourself. And there's so many ways we can do that. And we have a guest in the studio today. Her name is Sherry Ekman. Hi, Sherry. How are you?
Good. How are you?
Good. Thank you for being here. She's the vice president of Midwest Diagnostic Imaging. And I got to tell you, I just went for an image test, and we're going to get into that later because it's unbelievable the information we can find out on our own. And that's why she's here today. So when I say advocating for yourself, what I'm saying is speaking up for your needs and interests and making sure that they're known to other people. And it's a skill that can be so beneficial in all areas of life, especially when it comes to your health. So here's some tips for advocating for yourself. First of all, get to know yourself and understand your needs and what kind of support you need, right? Learn your rights and responsibilities, very important. Communicate clearly to others. Set boundaries. Create lines and limits, right, for yourself. Prioritize your care. So we need to take care of ourselves. We need to have a voice and we need to have a support system, right? That you can talk to people with and have a relationship with and be very assertive. When you see that there might be a problem with your health and you go to the emergency room and they're like, we've run all the tests. We just don't see anything. Okay, well, what about this? Well, can you do this? What else could it be? You just got to use your voice. And that is why Sherry is with us today, because we want to understand what Midwest Diagnostic does, because the inside of our bodies are completely different. Something is going on completely different than the outside of our bodies. We have a tendency to be so concerned about our wrinkles and our hair loss and our weight and right. But what we're not paying attention to, Sherry, is what's going on inside.
Right. It's like, have you ever known anyone who's went to the doctor because they just weren't feeling right and found out they have late stage cancer, or anyone who's had a stroke or a heart attack just out of the blue? A yearly screening, which is what Midwest Diagnostic Imaging does, you can detect potential health issues early, often before symptoms appear. Early detection through ultrasound can lead to more effective treatments and better outcomes.
And what's so amazing, when you walk into your office, like I mentioned, I did this test, you've got this warm feeling. It doesn't even look like a doctor's office. It's just a nice office. And you go into a little room and they have all the ultrasound equipment. And it's private pay. You just pay for whatever ultrasound you need. I mean, it's
right for the screenings.
For the screenings, right? So I did a stroke pre-screening is one of the ones I did. Tell them about what that finds for you.
Well, the stroke prevention screening, we do imaging of your carotid arteries to make sure that there's no plaque or blockages, which is going to stop the blood flow to the brain, which causes a stroke. We also check your abdominal aorta to make sure you don't have any aneurysms. We do an EKG to check your heart rhythm. And we also do ABIs on your lower extremities to check for blood clots.
What does ABI stand for?
Ankle brachial indices.
Yes, they did. They put like something around my ankle.
Blood pressure cuff. Yeah.
And what does that check for, you said?
Blood clots.
See, an important component, right?
Right. And the peripheral artery disease.
Right. So when I say you don't know what's going on the inside of your body, you have no idea.
Right. You don't know how many times we've had people come in that appear healthy, feel healthy, and find out that they have a 9-centimeter aortic aneurysm and they're on their way to the hospital in an ambulance for surgery. One little bump to the abdomen could have burst that aneurysm and lights out.
And what I find fascinating, and this is the part that's so interesting to me, usually you need to go to your PCP your primary care physician, get a script, go to a specific place that your insurance will cover.
Right.
And wait for 2 months maybe to get an appointment.
Right.
And it's never convenient. It's like 4 a.m. or something. Right? Yeah. So how is it that you've been able to do this private pay? Just explain. Maybe our listeners haven't heard of this concept before.
Well, screenings are not paid for by insurance because they are screenings. They're not full comprehensive studies like your doctor would order. So that's why they're a low-cost option, especially for people who don't have insurance and don't have that ability to be able to afford to have these studies done. It's just a DIY health.
Yeah, that's exactly. So it's all the screenings that you do. Right. So give us a list of some of the things that are available through Midwest Diagnostic.
Well, we can do an abdominal screening, which would check for gallstones, liver disease, kidney stones, thyroid nodules with our thyroid
ultrasound, which by the way, I did. It was so interesting. Okay. And then what other screenings do you have?
And another one about the abdomen is we find so much liver and kidney masses that are late stage that could have been detected much earlier. Because by the time you end up with symptoms and stuff, you're oftentimes stage 3, stage 4, and you're looking at a long road to recovery. Or if you have yearly screenings, you can find things like this that are very small and easy to take care of.
Well, true story. I have a dear friend who actually had a nodule on his kidney and didn't know it. So by the time it was detected, it was too late.
Right.
I mean, it was cancerous. So this is why, when I say advocate for yourself, this is why you walk in the door at Midwest Diagnostic Testing and you say, hey, can I do a pre-stroke screening?
Right.
I mean, why not? And then if there's an issue, then you go to your PCP and say, okay, now I need I need the whole workup, help me get past this.
Yeah, this is the first step. And then we can send the reports to your doctor and then they take it over from there if something is found.
Yeah. And so I did send my reports to my doctor that I had done. So I had the thyroid test, the stroke pre-screening and the echo, which, I work out, like I do so many things and never really even thought about having an echo, right? Mm-hmm. Because I thought I was healthy, which I am, thank goodness. But you don't know. This is the whole part of this. Right. We don't know what is going on inside our bodies unless you do some pre-screening. So I highly recommend this option because it's there. My goodness. So what made you decide that there was a need for annual screenings?
Because of all the pathology we've seen through the years. We've been going to doctors' offices and doing ultrasounds in their office 40 years. And we see so many times where you have the liver cancer, kidney cancer, DVTs,
DVTs are blood clots, right?
Yes.
Okay.
Patients having an echocardiogram and their ejection fraction is so low and they never knew that there was an issue.
So okay, exactly. I'm like, what is your ejection fraction supposed to be? Because I just got the ejection fraction number. Okay.
Right.
So what are some of the health issues that your technicians have seen? Like, I know you said cancer for sure, nodules.
We had a 45-year-old man who was physically fit, and he's the one that had the aortic aneurysm and that was rushed to the hospital.
Yeah, it was pretty big too. It was like the size of a golf ball, I think you told me.
Yeah.
And didn't have any idea.
Right.
Had no idea.
No idea.
Okay, so this is what I do want to say. Do not be fearful, because I can already sense in my spirit that people are like, well, why would I do that? I don't want to know. Well, yes, you do. If you can avoid having a stroke, why would you not want to know so you can do something about it? Now, if you're not willing to do something about it, that's a whole different level. Then we have a whole different conversation we need to have, because we've been given one life. We're here.
Your most precious asset.
We're here. We're breathing. We're blessed to be here. Let's make the best of it. But we want to live a long life. But the bottom line is we don't want to live a long life if we're so unhealthy and we had a stroke and we can't move the whole left side of our body. I mean, you still want to, but I'm just saying, let's be healthy and live a long life. And this is a perfect example of how you can get some pre-screenings done, and you can actually look at the information and then send it to your doctor, and move forward. So I want you to share your phone number with our listeners really quick.
It's 248-681-2000.
Okay, 248-681-2000. And when you call the office, actually, we'll get into this in the next segment, what happens when you call the office. So stay tuned. You're listening to Next Steps for Seniors, Conversations on Aging. And don't forget, this program is now available podcast. You can find us on any local podcast platform, Spotify, Apple, iHeart. We are looking forward to sharing this information with people you know that may need it. Again, Next Steps for Seniors, Conversations on Aging. We'll be back in just one moment to talk more about Midwest Diagnostic Imaging. Welcome back to Next Steps for Seniors, Conversations on Aging. Again, I'm your host, Wendy Jones, and our topic today is advocating for yourself. And in the studio, as you know, is Sherry Ekman, and she is the Vice President of Midwest Diagnostic Imaging. And it's located right in Waterford. Their phone number is 248-681-2000. Now, if you are not from Michigan, there is diagnostic imaging private pay available throughout the nation. You just got to Google it because otherwise you're coming to Michigan to get these tests done. So Sherry, I wanted to ask you, moving into this segment, what are the most popular screenings that you do?
We have our women's health package, which is a comprehensive screening, especially for women, which includes ultrasound screenings of the uterus, ovaries, bladder to detect cancer, cyst, endometriosis, fibroids, and other abnormalities.
Really quick, it is so difficult to find ovarian cancer. I mean, I've heard it repeat. I had a friend actually that had ovarian cancer, and it was impossible. There's no symptoms sometimes. And so you wouldn't even think to get it done. So I'm really glad you offer that for women. And you could know. I mean, it's people are like, why should I do this? Well, I say, why not?
Right.
Why wouldn't you? For 190, people spend that for dinner.
Right.
Or a bottle of wine or whatever. Yeah, why not do it? Okay, what are some of the other packages you have?
We offer the heart health package, which is an echocardiogram for early detection of conditions such as heart valve disorders, cardiomyopathy, congenital heart defects, COVID-related myocarditis.
And then the last one was the DVT screening, right?
Right. Lower arterial and venous Doppler to detect blood clots. After surgeries or injuries or just overall screening.
Now, what I find fascinating is, I mean, let's talk through the process. They called the office. We got the number right here, 248-681-2000.
Yeah, you can also go on our website and schedule right from our website.
Okay. And then how quickly can you get in a scheduled appointment?
Usually within a few days.
Okay.
We have openings.
Okay.
So you're not waiting months. Yeah, to get in.
Yeah, no, I think that's fantastic. And how long does the actual process take?
All of these take about a half hour.
Wonderful. And
they're non-invasive, painless ultrasound studies.
And so you also go to companies and do this for organizations, right? So if for example, if I wanted to have you come to Next Steps for Seniors office, tell us how that works.
Well, you call our office and we set up a day and time to come in. We have you schedule your employees. We only ask that you have an office or a room for us
with
to
a door,
set up in.
with a door,
yes.
A little room, not a cubicle.
Right, for privacy. And then we screen your staff. And it works perfectly because people can be working until it's their time for their screenings. They're not taking a half a day or a whole day off of work to come in and have the screenings done. And what better way to tell your employees that you care about them than to offer these screenings?
Well, all of mine are going to be listening to this program and they're going to be like, Wendy, when are you having us? So I think it's important to know that this is available. Well, you actually can bring the ultrasound equipment right in. I'm assuming it's got to be like similar screenings, like we'll do the stroke prevention, for example.
Right. They can pick any of these.
Oh, because it's the same equipment. Okay.
Yes.
Wow. Yep. Fantastic.
Mm-hmm.
What a great opportunity. Okay. So tell me a little bit more about, you said you had another story you could share with our listeners.
We had a man come in for screening, for heart screenings, and come to find out the ejection fraction was 32%. And he had no symptoms at all, no dizziness, no shortness of breath. And he was going to train for a marathon. So he came in and just wanted the screening to check his heart. Because, and this is the time of year where everybody makes their New Year's resolutions that they're going to eat healthier. They're going to start exercising. Yes. Well, are you healthy enough to work out? So, it's a good way to just make sure that you're healthy enough to start an exercise routine. Right. So because he found this out, he went to his cardiologist, was placed on medications, and now it's back up to 53. So he's doing well.
Yeah, it can make a difference.
Yes.
Absolutely. So you actually send the actual report to the physicians if they ask, because I was going to ask about HIPAA, how that works, your HIPAA compliance. Who has access to the reporting?
Well, that's up to the patient. We send it directly to the patient, and they can let us know if they want it to go to their doctor.
My next question is there any prep needed for any of these tests?
Yes. If you're having an abdominal screening, you'll need to stop eating after midnight if your appointment is in the AM, and by 6 a.m. if your appointment is in the afternoon. If you're having the women's health package screening, you will want to drink 32 ounces of water an hour before your arrival, because it needs to be a full bladder.
So they'll let you know if there's something that they need to do prior to the screening test. Okay.
Yes.
Okay. Excellent. Excellent. And let me ask you this question. Who reads the screenings at the end of the day?
Okay. We have 2 radiologists and a cardiologist who read the studies and give us a report, which we then send to you.
And that comes right into your email, correct?
Correct.
Oh my gosh. I mean, why would we not do this?
Right. Yeah, it's so simple.
And I'm sure people all the time are like, I wish I would have done this like a long time ago.
Right. Especially when you get that bad outcome that it could have been caught so much earlier.
So speaking of outcome, like what does the report look like?
Well, it'll give you all of your measurements of like your abdominal organs and your measurements for your heart echocardiogram. And then at the bottom, you'll get a synopsis or a summary telling you exactly what was found or not found.
So in my mind, this is such an innovative way to take your health into your own hands. Now, obviously, we're not doctors. And if we're sensing, hey, I've had tingling in my hands or my left arm, or I've had a little bit of pain in my chest. Why wouldn't you just pay the $149 and go tomorrow, right?
Right.
And get this test done, and then have a radiologist read it, and then you look at it and go, there is a problem, or, oh, I'm fine. But either way, you send it to the doctor, and then you say, hey, can I get into the doctor to see you? And then it might be 2 weeks, but at least right?
Right.
Because if it's urgent, they take you straight. You've had people go straight to the hospital from your office.
Absolutely.
But if it's not urgent, you have time to do the proper follow-up. But I think my personal opinion is a lot of people don't go to their primary care physician or don't go for testing because it takes too long. You have to take time off of work. It's expensive. Your insurance doesn't cover it. I mean, all these reasons, right?
Right.
But the reality of the situation is if you can do this, pay privately, show up at tomorrow or this week, right? Mm-hmm. And know what those answers are. Why wouldn't we be doing this?
Exactly.
Take it into our own hands. Do the research yourself. We are the person that knows our bodies the best. And the biggest problem I see when we walk in, especially for our sweet seniors, when we walk into a doctor, we have a hard time hearing them. Right? We don't understand what the tests are. Sometimes they talk fast and we don't even know what they're saying. So it would be it would be easier for them just to come to your office where there's one person who's doing this test that's talking. She was so sweet. She was talking to me the whole time. It was just a great experience. There wasn't a lot of anxiety because you weren't going to a hospital or like a big clinic somewhere.
Or a long walk to get in.
You've got a ramp coming in. I mean, the whole thing is so much easier just to have that available to you. Mm-hmm. So I want to say thank you. Thank you for doing this. I think it's fantastic. Listeners, I feel like if you have any indication, and even if you don't, why not go spend $149 and get this looked at? I can tell you story after story after story of people that have had strokes that literally had no idea it was coming and they actually passed away from it. I mean, we have people, seniors that had no clue. So this is why you are your best advocate. So pick up the phone, call Midwest Diagnostic Imaging. Their phone number again is 248-681-2000. Thank you for listening to Next Steps for Seniors.